I'm in.
Hi, my name is Reva. I'm going to be your nurse today. We're going to do a full head to toe assessment on you. Okay.
Okay.
Can you tell me your, let me see, just to be sure I've got the right one, turn it over.
Okay.
Can you tell me your full name and date of birth?
Zachary Hackison, May 29th, 2005.
Okay, perfect. So what I'm going to do is go ahead and wash my hands. Make sure the area is safe for me and you. I've got the right person. I'm going to go ahead and pull this curtain for privacy, okay?
Okay.
Can you tell me tell me where you are today?
I'm in the hospital.
Okay. And can you tell me why you're here?
Checkup.
Checkup? Perfect. And can you tell me who the president is?
Joe Biden.
And what year is it?
2021.
One more time for me.
2021.
2021. Okay. Patient is alert and oriented ×3 plus oriented to situation. Hygiene is appropriate. The posture is nice and tall. Spine length is nice and tall. Everything looks good with that, okay? I am going to go ahead and look at your head to begin with. Have you hit your head recently?
Nope.
Okay. So I'm looking for bumps, lumps, lesions. I don't see any bumps, lumps, lesions. Mass is noted. No parasites to be noted. Head is normosympathetic. Everything looks good with that. I'm going to go ahead and have a seat next to you because there's a few things we're going to do.
Okay.
Okay. If you just want to turn your chair just a little bit towards me. All right. Have you had any recent changes in smell?
Nope.
Nope. Perfect. Let me go ahead, if you're going to come just a little bit, and I want you just to lean your head back just for a second. Let me take a look in there. All right. So no redness, lesions, drainage. Nose is midline. Nasal septum is midline, no deviations. If you just plug one nostril and breathe in for me, and the other nostril and breathe in. Nares are patent bilaterally. Cranial nerve number 1 is intact. Eyes are symmetrical. They are appropriately placed in line with the ears. Pupils are about a size 6 and they're round. If you would just go ahead and look at me in my nose, I'm going to shine a light into your eye. Ready? And good. We're going to do this one more time on this side. Perfect. Perfect. One more time. Great. I'm going to have you follow my fingers all the way to your nose. That's great. If you just face forward for me, I'm going to get behind you. And I'm going to check your peripheral vision. So let me know when you see my hands.
No.
In now?
No. No.
Okay. Peripheral vision is in check. I am going to have you do a Snellen chart eye vision for me. So what we're going to do is have our patient stand 20 feet back. You will cover one eye and read the lowest line that you can see. Okay, so if you can cover one eye and read that lowest line for me.
A, B, C, D.
Okay, cover the other eye. Read that lowest line for me.
A, B, C, D.
And read both.
A, B, C, D.
So if our patient has 20/40 vision, our patient would need to stand at 20 feet to read that chart, where someone with no visual impairments would need to stand or could see at 40 feet. Okay, cranial nerve number 2 is intact. So also if you just go ahead and face me a little bit, I just want to make sure the camera can see us. All right, I want you to look at me in my nose, and I'm going to go ahead and have you follow my fingers. Cranial nerve number 3, 4, and 6 are intact. Cranial nerve number 5, we're going to do next. I'm going to go ahead and have you close your eyes for me, and I want you to tell me where I'm touching, okay?
Chin, cheek.
Okay, cranial nerve number 5 is intact. Can you clench your mouth for me? And I'm going to try to open your jaw, and I just don't want you to let me. All right. Can you smile really big with your teeth? All right, frown for me. Puff out your cheeks. Raise your eyebrows. Lower your eyebrows. Perfect. So hair is evenly distributed on the head. We would have done that at cranial or in the head inspection. Eyelashes and eyebrows are evenly distributed as well, and we would have done that with the cranial nerve number 2 portion. So just want to make sure that's in there. Cranial nerve number 7 is complete. So when we have moved to cranial nerve number 8, and those are going to be the ears. So if you just face forward for me, I'm going to get right next to you. Have you had any changes in hearing?
Nope.
Before I do that, let me go ahead and correct myself. Can you just look really quick and let me look into your sacs really quick? All right. Conjunctival sacs are clear with no drainage, redness, or lesions. So I am going to go ahead and finish with cranial nerve number 8, which are the ears. Any changes in hearing?
Nope.
All right. I'm going to go ahead and pull the tragus and push the pinna. Is there any tenderness?
Nope.
I'm going to go ahead and take a look on this side. Perfect. I'm going to do the same on the other. Again, I'm going to push on, pull the tragus and push that pinna. Anything?
Nope.
Any tenderness? And I'm just going to take a quick look with my light. All right. So in order to see in the light, I don't know if you can see this in the video, we do have to pull in this tragus a little bit and then shine the light into the ear in order for us to see. So I am going to stand behind you, and I want you to tell me which side of hearing do you hear?
This side.
No, you got to say left or right.
Oh, right?
Yeah.
Left.
All right. Cranial nerve number 8 is intact. There is no drainage, lesions, or excess cerumen on either side of these ears bilaterally, so that is good with that. So we have cranial nerve number 8 is intact. We're going to go cranial nerve number 9, 10, and 12. So if you would just face me for a second here. I'm just going to pull a little bit closer because I just need to see. All right, perfect. I'm going to have some knees touching. All right. So cranial nerve number 9, 10, and 12 are going to have to do with your mouth. So lips are pink and moist and free of lesions. So I'm going to have you, oh, I feel like I'm going to sneeze. Okay, stick out your tongue for me. And you're going to do left, right, up and down. All right, tongue range of motion is intact as well as appropriately rough, pink, and moist. I'm going to have you open up your mouth for me. All right, teeth are in appropriate repair. There are no bleeding, redness, or inflammation for the gums. Oral mucous membranes are pink and moist. I'm going to have you stick out your tongue and say "ah" for me. All right. Tonsils are 2+ bilaterally, and the uvula rises with phonation. So that is good with that. I'm going to have you let me know if there's any changes in your swallowing. Have you had any changes in swallowing, gagging, anything to that nature? Nope. So if you just sit up nice and straight for me, I am going to have you, I'm going to push against your throat here. Swallow for me. All right. So swallow muscles are equally bilaterally very strong. Cranial nerves number 9, 10, and 12 are intact. We're going to do cranial nerves number 11. So with this, I'm going to go ahead and provide some resistance, and you're just going to shrug your shoulders for me, okay? All right, great. And then I want you to turn in. Good, and then do the same thing for the other side, please. All right. Neck muscles and shoulder muscles are 5 out of 5. Cranial nerve number 11 is intact. So with that, we are going to go ahead and move into our reflexes. So I'm going to go ahead and have you just turn to your knees or in the front here. And I'm going to start with the tricep reflexes. So if you just see your arm, please, and I just want you nice and loose, nice and loosey-goosey, okay? So we're going to do right here above the elbow. And let me just switch hands here. If you just turn your head for me. All right, ready? Good. And then we're going to go ahead and do the other side for the triceps. So again, we're going to do hanging out like a scarecrow. Go ahead and look to the other side, please. And perfect. Tricep reflexes are intact bilaterally. I'm going to move to the bicep reflexes. So on this side, I'm going to have you just go ahead and pull as much as you can up for me. I need to go up quite a bit. All right, perfect. So if you just kind of make a little ball, a little fist for me. Perfect. All right, relax all the way. And I need you to look over there at that wall. And what color is it?
White.
Perfect. And let's go ahead and do the other side. All right, and go ahead and ball up that fist for me. All right. And then let's go ahead and relax. Can you tell me what color that wall is?
White.
All right. Bicep reflexes are intact bilaterally. I am going to go ahead and see your arms here. And I just want you to rest it in line. We're going to go 3 inches up. All right. And can you look over there and tell me what color the door is?
Black.
All right. Let me go ahead here. I'm just resting my arm. Again, 3 inches up. And can you tell me what color the carpet is by the door?
Blue.
All right. Brachioradialis reflexes are intact bilaterally. Next thing I'm going to have you do is stand up for me, and I want you to put your knee into this chair.
My knee. Yes.
Yeah, but I want your bottom towards me. Here, just place your, there we go. Knee in the chair. So, Achilles reflexes, perfect. And put your leg down. And the other knee up, please. And we're checking the Achilles moves. All right, the Achilles reflex is intact bilaterally. Please go ahead and put your legs down. All right. I'm going to have you put your feet on my lap, please. And we're going to check the plantar reflexes. So we're going to take the blunt of the instrument, of the hammer here. It's sort of pointed and rounded, and we are going to make an upside down J on the patient's foot, and we should see the toes react, and he does have a reaction there. And again, we're going to do the same thing on the other side. And this one you'll be able to see my technique a little bit better. All right, plantar reflexes are intact bilaterally. I'm going to check, I'm going to go ahead and check the glands. So let's go ahead nice and strong. And I'm going to move this aside, put your head down for me, and swallow. All right, thyroid gland is non-palpable. Was that tender?
No.
And non-tender. So we are going to go ahead and go nice and tall for me. The glands here. So we have submental. Are these anything? If anything is tender, you just let me know. Submental, submandibular. All right. Tonsillar. Okay. Pre-auricular right before the ears. Post-auricular right behind the ears. Pre-clavicle. No. Cervical, post-cervical, and then occipital is in the back, and then subclavicular. Okay, all of these are non-palpable and non-tender glands. All right, so the next thing that I'm going to have you do before I listen to your chest, before we go on, is I want to go ahead and have you walk to that desk for me and walk back. All the way. So the gait is steady gait, no limping. Come on back. No limping, no shuffling of feet. Exactly what we'd like to see. So stand up for me.
Oh, stand up. Okay.
All right, I'm going to have you do some, we need to be in the camera view. I'm going to have you do some, let me just adjust really quick because I want to make sure that we get full points. All right, so I'm going to have you go ahead and do some big arm circles for me. Make sure they're pretty big, nice and tall. All right, and then some back arm circles for me. All right, great. And then can you hug yourself this way, hug yourself this way. All right, so full range of motion on the upper extremities. Can you do some leg circles on the ground as well? And I'm just going to move the camera while you do that. Some leg circles, some other leg circle, other leg please. All right, lower extremities are intact. I am going to, and full range of motion, I want you to lift your head up to the ceiling, down to the floor, side, other side. All right, full range of motion in the neck, upper extremities, lower extremities. I am going to do my Romberg test now, so I want you to go ahead and put your feet all the way together for me. All right, perfect. Hands by your side, and I'm going to have you close your eyes. 20 seconds has elapsed. Romper test is negative. You can go ahead and have a seat. And this part of the, come over here a little bit closer. At this part of the exam, we are going to start listening to your chest, and I'm going to listen to your lungs. Again, skin color is appropriately pink for ethnicity. There's no clubbing or cyanosis in the fingers. Everything looks good with that. No axillary muscles are used at this time. AP to lateral is 1:2 ratio. Okay. And we'll be able to see your chest. AP to 1 ratio. The breath 13. Respiratory rate is 13 breaths per second. Medium depth and consistent rhythm. Okay. So that looks good. What I will have you do is remove your shirt. I'm going to listen to your heart sounds. Then we'll listen to your breath sounds. If it takes me a little bit longer, just note that there's nothing wrong. I'm just being very, very thorough at this time, okay? You just take that off for me. Anytime that we do listening for any of the breath sounds or anything really to do with the stethoscope, we are going to do skin on skin. So I will be asking my patient to remove the shirt or for modesty purposes, use a gown. All right. So the first thing I'm going to do is listen into the heart. So I'm just going to have you turn your chair a little bit so we have no issues with lighting. I know it's going to be a little shaded. Okay, so I'm going to listen to the right sternal border. And this is where S2 is going to be the loudest. And this is the aortic valve. And so I'm going to listen to the left sternum border, and then it's going to be right there at the second intercostal space, right on the other side. And that is nice and strong. Then I'm going to do the third intercostal space, which is Erb's point, which is not a valve, but actually where you can hear S1 and S2 equally. And then I'm going to the fourth costal space, and that is where the tricuspid valve, you're going to be able to see the tricuspid valve, or not here, I see, but here, the tricuspid valve. And then we are going to go mid-clavicular to the fifth intercostal space, so I will be moving this up and right in here. And this is where you're going to hear S1 the loudest. All right, S1 and S2 heard, no murmurs and no extra heart sounds. Okay, that was great. I am going to have you, for this exercise, I'll have you breathe open with an open mouth the first 2 times that I listen on either side. The rest of that is just for placement for my professor to see, okay? So with a loud open mouth, can you, and we just want to go right above that clavicle. So with a loud open mouth in, a loud open mouth, wide open, breathe in and out. All right, and again. All right, and again. And I'm just going to get underneath here because I want to take a good listen. And underneath here, I'm going to take a good listen. One more time. All right. Anterior. You okay?
I'm good now. Throat itches. I'm good now.
Anterior chest cavity clear. Normal breath sounds throughout. So it's clear throughout the anterior cavity. I do want to listen to the axillary muscle or the axillary breath sounds. So if you just lift this arm, and I'm going to go here. That's clear. I'm going to go here. Perfect. And then again, if you just want to put this arm here, I'm going to turn sideways here. That's clear, and that is clear. So auxiliary breath sounds are clear either side, clear bilaterally. I'm going to go ahead and have you turn sideways in your chair here, and I'm pull up your pants a little bit. All right, and I want your back to the, pull up your pants again real quick. All right. All right, breath sounds, and again, we're going to listen. Breathe in. Wide open mouth. And then we are going to go in between. So I'm going in between the scapula and the spine to listen. Nice and tall. All right, posterior breath sounds are, posterior respiratory sounds are clear. So I am going to do the tactile fremitus right now. So I am going to have my patient say 99 every time I move my hands. Go ahead.
99, 99, 99, 99, 99.
Okay. So tactile fremitus is equally bilaterally, or equally throughout. And then I'm going to do all right, I need to take a deep breath in. And thoracic expansion is equal bilaterally. And then I'm going to take my fingers and we're just going to, nice and tall, rub down the spine. All right, the spine is straight. I am going to let me know if you feel any pain or tenderness. Any tenderness? CVA is non-tender either side, or non-tender bilaterally. So at this time, I'm going to go ahead and have you lay down for me. And I'm just going to move some stuff out of the way so we can do this. Typically, we won't have a sleeping cat in the lab. All right, go ahead and head at the top for me. And we are going to just move the camera a little bit so you can see all the way to the top so you can have your feet up there as well. So here we go. Sorry about the camera changes. All right, perfect. So while my patient is laying here, I'm going to go ahead and ask, when was the last time that you had a bowel movement?
Yesterday.
Yesterday. And was it soft, hard?
Soft.
Soft? Okay. And what color was it?
Brown.
Just a brown one? Okay. And then was the last time that you urinated?
This morning.
And what color was it?
Yellow.
All right. And any urgency when using the restroom?
No.
Okay. Any burning sensation or uncomfortable pain?
No.
No. Okay. So no burning sensation, no uncomfortable pain upon urination. What color is it? Is your urine?
Yellow.
Just a yellow urine. Okay. So before I listen, I'm going to get down level and look at his belly, and his abdominal cavity is flat, so he is flat, no roundness. I am going to listen to the stomach sounds, and so I'm going to start on the right quadrant. And this is a left lower quadrant. Right upper quadrant. Left upper quadrant. All right, vowel sounds were noted in each quadrant. And what I'm doing now is I'm going to go ahead and you just let me know if this is tender in any of these.
Okay.
Any tenderness?
No.
Any tenderness? No, just tickles? Okay.
Yeah, tickles.
So if you just put your arms down by your side, I know this is very uncomfortable, I'll be fast. So what I'm feeling for is muscle tone. Muscle tone is appropriate in upper extremity. No edema. I'm looking for edema. No bruising, no rashes, no lesions on any of the upper extremities. And then I'm going to feel the upper extremities with my back of my hands. And skin is warm and dry. Okay, and the temperature is appropriate to the core temperature, so it is the same. And then again, we're going to do this at the legs, and we just want to feel for muscle tone. We have appropriate muscle tone in the legs. I'm looking for bruises, lesions, edema, and then the temperature is appropriate to core temperature, so no heat changes, no extra warmth, no coldness noted on any of the legs. All right, so one of the first things that I'm going to do is feel the brachial. So right here, it's 2 plus over 4 plus bilaterally. We'll go the radial. 2 plus over 4 plus bilaterally. And then popliteal is 2 plus over 4 plus bilaterally. This anterior dorsi, 2 plus over 4 plus bilaterally. And dorsalis pediis, 2 plus over 4 plus bilaterally. All right, go ahead and sit up for me. You need a little bit of hand. Okay, go ahead and you can place your shirt back on. All right, that concludes the end of our. Oh, I'm exhausted. That includes the end of our examination. Did you have any questions about the examination that we did?
No.
Okay. Do you have any questions about the procedure that you'll be having later on today? We'll be drawing some labs. Any questions about what kind of labs we'll be drawing?
Nope.
All right. I am going to go ahead and give you the call light. So this is your call light. You can go ahead and press it. If you have any questions, me and my colleagues will be more than happy to assist you. I'll be back in an hour just to check and see how you're doing. And like I said, in the meantime, use that call button, okay?
Okay.
Would you like this door open or shut?
Shut, please.
All right, I will go ahead and leave the door shut. I am going to go ahead and finish up and wash my hands for 20 seconds. I will sterilize all my equipment. I am leaving the door shut for our patient, and that concludes the end of